To Member for Higgins, if we could start the clock. Thank you.
Thank you, Madam Deputy Speaker. Madam Deputy Speaker, I rise in this chamber to note the important work done to date in pursuit of eradicating polio worldwide, a noble goal indeed, and acknowledge the contributions to this body of work by the Australian Polio Advocacy and Communications Team Group and advocates right across Australia, including Rotary International Australia, UNICEF Australia, Global Citizen and Results Australia as part of the Global Polio Eradication Initiative. I first and foremost thank them for their contributions and commitment to further progressing this field of medicine. Their ongoing work is invaluable in the fight against polio. Madam Deputy Speaker, as a paediatrician and doctor, I'm passionate about promoting preventive health measures, and as the co-chair of the Parliamentary Friends of UNICEF group, I'm equally passionate about being a voice for all matters affecting children. Madam Deputy Speaker, in 2019 I visited Papua New Guinea with Save the Children as part of a parliamentary tour. And quite frankly, it was shocking to see some of the health events that are occurring in PNG, and that is including outbreaks of polio. There's so much more work to be done, and we need to work together in a collaborative manner to ensure that that children have a good and healthy start to life. And immunisation programs, such as the polio program, is absolutely essential to that. As a young paediatrician, I visited Fairfield Hospital and saw people who'd been in iron lungs for 40 years. This is a disease that has been deadly, but more than that, it's also devastating. Importantly, polio is an easily preventable but life-changing and life-threatening virus causing severe disability. 1 in 200 polio infections lead to irreversible paralysis, with many more leading to lifelong disability and considerable pain. And when I saw those brave men and women in these iron lungs unable to move for so many decades, it is heartrending. Madam Deputy Speaker, among those paralysed, 5 to 10% die when their breathing muscles become immobilised. Worse still, polio mainly affects young children under 5 years of age, and for decades and centuries, it has been the scourge of young children until a polio vaccine became available. The Global Polio Eradication Initiative is a global effort to eradicate polio. And when it commenced in 1988, more than 350,000 cases of polio paralysed and killed children in 125 countries annually. Now polio is 99% eradicated and remains in only 2 countries, Pakistan and Afghanistan, with the entire African continent certified as polio-free on August the 25th last year, 2020. That is a massive achievement and is to do with the good work of the men and women who support these sorts of initiatives globally. The reintroduction of increased polio infections in Pakistan and Afghanistan occurred due to low community immunisation rates. And that's what happens when immunisation rates fall, so does herd immunity, and then everyone in the community is at risk. The government recognised the COVID-19 pandemic has had far-reaching impacts on the polio vaccination program. Thankfully, not here in Australia, we have very high and good immunisation rates. But due to the pandemic, polio eradication efforts have slowed and the progress made so far is now at risk. With this in mind, we support the GPEI and its partners to re-establish momentum on polio immunisation in the remaining endemic countries. The rollout of COVID-19 vaccine provides an opportunity to accelerate integration and progress multiple health outcomes on a global scale. The widespread success of the polio program demonstrates again the extreme effectiveness of a widely available vaccination program, and today is the first day that the COVID vaccine is being rolled out here in Australia. I think as Australians on both sides of the parliament, I think we should all be very proud of this momentous day. The polio program, to the credit of health organisations, has proven the benefits 1 million times over. Mr Deputy Speaker, I'm very proud our federal government has committed funding and support to the global eradication of polio. The Morrison government has pledged $69 million in funding to the GPEI to support eradication and manage the risk of polio. As respective polio champion and polio gender champion, the Minister for Health and Minister for Women, Greg Hunt and Maurice Payne, continue to support the GPEI both within Australia and internationally through a range of measures. We should congratulate the work that is being done by Australia to support this program. Thank you, Madam Deputy Speaker.